Okay, so I have a chance to be invited to the Yaroslav Symposium, and thanks to Ipsen. And I want to thank Ipsen for organizing this session, but also for providing a new product for bowel cleansing. We need more new products for bowel cleansing, okay? To increase what we call the patient compliance, because the patient compliance is a key for successful bowel preparation, which is a key for an effective colonoscopy, and it mainly depends on two factors. The first one is the product itself, palatability, taste, volume, etc., side effects, and also the information to the patient. So these are two key issues. I will just say a few words about the information to the patient, because I've been president of ESG, so it was my role to try to increase the quality of information to the patient. So that's why I launched a patient committee, a committee dedicated to patient, and soon you will see on the ESG website, you will see some videos to inform a patient about endoscopy. So at ESG wrote a guideline, so oral and written information should be given about bowel preparation. Also, okay, mine is in English, and these are, of course, in Cyrillic, in Russian. Okay, so it's more difficult for me to follow like this. Okay, I can do, but okay. So it should be delivered by healthcare professionals, and it is strong recommendation, and not by an assistant, by a nurse or by a doctor. And even more, for the French Society of Digestive Endoscopy, the minimal duration of a consultation should be 15 minutes to inform on colonoscopy, but also to inform on bowel cleansing. And the information should be personalized, taking into account the patient. It's by law, in fact. And if possible, we have to use leaflets or video. Now we move to the product itself. So the product should be easy to take by the patient, and that means low volume, good taste if possible. It's never a good taste, acceptable taste, and no side effects. So that's why Ipsen is now providing Easy-Clean. So what is Easy-Clean? It's a low volume hypertonic associational sulfate salts. And it has been developed to allow effective and safe bowel cleansing. And you will see the result later, so I will not comment these 2 lines. Initially, it has been developed in US, and it's marketed in US since 2010, and then in Europe since 2013. And the name is Easy-Clean or Easynova, depending on the country. I don't know why, but okay. And by Ipsen and partners of Ipsen. So at least in USA, it has to be known that it's a very, very popular bowel cleansing. For example, if you look in 2018, okay, this is the first row, you see. So Suprep represents more than 40% of the market. And Suprep is, of course, Easy-Clean. On the opposite, the other preparations, they are not so well accepted. And you see that the rate is increasing. So which are the recent development in the world in general? So first there was what we call the ESTER study, the Russian registration study, which will be presented by Evgenis in a few minutes. Then there was a safety study by the European Medication Agency, ongoing a Chinese study, and there is also a study ongoing for pediatricians. So which are the main characteristics of a product? So it's an association of free sulfate, that sometimes we call free sulfate preparation. And the total volume intake is 1 liter of hypertonic preparation, plus 2 liters of clear liquid, which can be chosen by the patient. And how does it work? Which is the principle behind? In fact, it is an osmotically acting laxative. So in fact, the sulfate salts provide sulfate anions here. And this onions are not well transported, and the transport is saturable. So, and then the onions remain in the bowel, and then they produce an osmotic effect, and then they cause water retention in the bowel. So then it has induced cleansing of the bowel. I try to follow Russian. I'm not so good for this, but I do my best. Huh? So, practically speaking, the kit does contains 2 bottles of a preparation. That means each bottle does represent 180 milliliter, and you have also a dosing cup of 500 millimeter, just to ensure correct reconstitution and hydration, and of course hydration of the patient. So briefly, in fact, the product can be given using 2 regimens. First one is the classical split dose, which is usually recommended. So split dose means 2 days, or a 1-day regimen, depending when you perform the procedure. But also you can perform split dose if, for example, if the procedure is performed at the end of the day. In my unit we do some procedure very late in the afternoon, so then we use split dose but the same day. So split dose is usually recommended. And as usually, we have to take into account the fact that the patient requires sedation, and at the same time requires sedation. That means you should have an interval between the preparation and the sedation. But in the same, also the interval should not be too long to allow a good preparation. So 2 or 3 hours after prior sedation, or without sedation 1 hour. And we have to encourage patients to take liquid after the colonoscopy. So, in fact, practically speaking, you pour in the cup the preparation itself, which does represent 180 milliliter. Then you put water, and then you drink totally 500 milliliter. And to have hydration, you recommend the patient to take 1 liter more using the cup. So this is the first dose. And second dose is the same, of course. Huh? Same. And so finally you have 2 possibilities. The first one is in the past 1-day dosing regimen. So that means the prep itself, hydration, the prep itself, hydration, so totally 3 liters, but only 1 liter of preparation. And the split, that means you split and you have an interval in between. This is the day before and this is the day of colonoscopy. I will do a brief overview of all studies. Some studies have been performed in Europe, but some studies out of Europe, because the product initially was launched in USA. So you recognize some of this name. Probably the more famous is this one, of Esther study with Fedorov. But initially, first study was performed by Di Palma, but I will begin by this study from Doug Rex. Because this study compare, in fact, Eziclen to PEG. And PEG in the past was the gold standard, was the standard. So this is the study. So it was a randomized study, published, you see, in 2010. And it compares Eziclen split versus PEG the evening before, as classical regimen. And they included 136 patients, and they use a special scale I will show you later. And these are the results. So the results are really, I think, impressive in favor of Eziclen. And it was a non-inferiority study. And you see that, in fact, of course, Eziclen was non-inferior to PEG. And if you look at the excellent preparation, so you see a huge difference between Eziclen and PEG. And side effects, the rate were more or less the same. And at the end, you have less residual stools and liquid in the ascending colon and the cecum, such as on this slide. If you look at the residual stools, that means absence of residual stools or absence of residual fluid, you see a huge effect of aceclane. And aceclane demonstrates high cleansing efficacy in all colon segments, including the cecum and the right colon, which is usually everybody knows that these parts of the colon are sometimes difficult to clean, and this is always difficult to get a nice or excellent bowel cleansing in the cecum, and we are frequently obliged to clean ourselves using irrigation pump, the cecum. And concerning the compliance, also the data are very interesting because you see that the compare with aceclane. In fact, all patients had excellent. They took the whole preparation with aceclane, and only 91% with PEG. And 97 found the cleansing preparation with aceclane easy or tolerable, and 94% they wanted to repeat in case the same preparation. They wanted to take the same preparation. They prefer sulfates to PEG. So this was for the REC study. So it was clear that the product, well compared, was not inferior, but more or less was superior to PEG. Fortunately, because the patients do not like PEG, especially 4 liters. I had not the chance, but I was obliged to have colonoscopy myself, and I took 4 liters once and 6 liters another time. So it's crazy, huh? At the end, I suffered of nausea a lot. PEG. The second study, DiPalma, and they compare Moviprep to aceclane, and in fact they compare. Using two regimens, the same day dosing, so 408 patients were included here, and the split dosing, 364 patients. So it's a little complex study, but at least they tried to evaluate all regimens and the 2 products. And they use this scale, very simple scale, and you see excellent, good, and fair, and poor result. Very, very simple scale. Okay. And what they observe is that, in fact, if they compare aceclane to Moviprep, you see that the rate of, when we speak about 1 day regimen, the rate was a little higher with aceclane in comparison to Moviprep, and the same for split dose. And finally, aceclane was non-inferior to Moviprep, and the difference was statistically significant. And the conclusion was aceclane is as effective as Moviprep in both dosing regimen, and even for elderly patients. So this was a good news for, of course, trisulfate. And in fact, if you look at this slide, just look at the first line, okay? The first line does concern excellent bowel cleansing. And if you see split dose, you see a difference which is statistically significant between aceclane and Moviprep. So more excellent results than Moviprep in split dose regimen. Then another interesting, but I don't want to say it's a little boring, but at least when we are speaking about bowel cleansing, we need to compare the different products. These are scientific data, okay? Even if we don't consider as bowel cleansing as a very, very interesting topic, nevertheless, we need to conduct an excellent clinical research around bowel cleansing. And so this one was interesting. They compare Prepopic to Isinova or to aceclane. And it was a randomized study also, and they included 338 patients. And in fact, that's the observe, and these are the rate of excellent and the rate of good bowel cleansing. And in fact, they observe that using EasyClean, you see the rate of excellent results was double than for PicoPrep or PrepOpic. So quite convincing results in comparison to a so-called classical and very quite popular preparations as PrepOpic. And percent of the patients with no salt bicolonic segment. In fact, if you compare EasyClean to PrepOpic, PicoPrep, we say in front PicoPrep. In fact, it was much higher in all segments. We're using EasyClean. And of course, when you speak about bowel cleansing, you should look on the quality of the cleansing, but you should also look on side effects. That's why, for example, phosphosoda has been abandoned because of side effects. So side effects are very important to be evaluated. It's very important to evaluate side effects. And you see the side effects. In fact, maybe the only side effects related to EasyClean are nausea. But there are minor side effects. You see, 44 in comparison to 27 for PicoPrep. This is maybe the only disadvantage, which is not a major disadvantage. And just coming back to all studies, the Di Palma and the REC studies, concerning adverse events, in fact, you see that there is no difference between EasyClean here for all items, including nausea and vomiting, in comparison to MoviPrep here, or in comparison to PEG here. So overall incidence of complications and symptoms, that means minor side effects, is similar between the three products. And finally, the best of the best, the Fedorov study. But I will not comment on this because Evgeny is here, so he is in a better position than me to comment this study. So just to finish, I think it's important also to first of all to speak about post-registration study, yeah, but also to speak about an interesting bowel cleansing product, which is PlanView. And PlanView is also the popularity of PlanView is growing, such as the popularity of EasyClean. So it's interesting to speak and to compare the two products. And this is the NOx studies, and they compare. It's a randomized study, and they compare both products. That means EasyClean with NER 1006, which is PlanView. In fact, what is NER 1006? It's 1 liter PEG plus a very high dose of ascorbate, because ascorbate has a laxative effect, but it is very high dose. So 626 patients were included in this non-inferiority study, using split dose and using more modern scales, in fact, Arrayfield and Boston scales. Just, what is this product, PlanView? If you compare PlanView to MoviPrep, you see you have two doses, and MoviPrep, the doses are the same, okay? The two doses are the same content of the same concentration of ascorbate. Yeah, 9.5. On the opposite, in the new product, you have a high concentration within the second dose. So that means the total concentration is very high, 48 in comparison to 9. So it makes the difference. And so the quality of cleansing using PlanView was non-inferior to EasyClean, concerning the successful and concerning exam ascending colon preparation. And if you see by segment, there is no major difference in between the two preparations. And if you look at the detection of lesion, also the same. No statistically significant difference. So for products are basically equivalent. Nevertheless, there are some concern related to the fact that they use a very hyperosmotic low volume preparation, and the dose of concentration of ascorbate is very, very high. And there was a recent editorial by Doug Rex. Everybody knows Doug Rex. He's the master of colonoscopy in USA, in the world, after Regular and after Fedorov, of course. And in fact, if you look at the data from the NOx study, you see, you compare trisulfate, that means eziclen, to Plenview, you see huge difference concerning elevated serum sodium and elevated serum chloride, and also quite high rate of dehydration and nausea and vomiting. Despite I told you that maybe the main disadvantage of eziclen is nausea. In fact, in this study, the rate was high of nausea was higher with Plenview. And so this side effects or this high concentration of electrolyte were also observed within the other studies. And when they compare the product to other products, including eziclen, they observe hypernatremia. And so this was within the letter of Doug Rex. And in fact, he wrote that Plenview is associated with unprecedented incidence of hypernatremia. And clinicians should know this. And they should understand this potential risk of dehydration, for example, and they should encourage people to take 2 liters of water. In addition to the 1 liter of active compound. So that means at the end you still have 3 liters, and it's not 2 liters, 3 liters using Plenview. And the caution should be, you should take some caution in high-risk population. 2 post-registration studies, one performed thanks to Yaroslav, so I will not speak about, and I suppose Yaroslav will present this later. And finally, this is one of my last slides. It's a post-marketing observational study. It did concern 300,000 colonoscopy. And they compare the overall incidence of side effects. And they observe that in comparison to over preparation, you see that the incidence of side effects with eziclen was lower. And it does concern also renal side effects or abnormalities of serum electrolytes. So it seems that not the morbidity, but side effects related to eziclen are lower than with other products. And there was no significant difference between cohorts. And if you look at the seizure disorders, aggravation of gut and ischemic colitis, no difference. So to conclude, these are the guidelines of EAG 2013. I will not enter into details, okay? These were the guidelines. But we will have we will update the guidelines this year. So these guidelines are more or less no more useless. And I personally, I had the chance as a past president of EAG to have a careful look on the guideline. And this guideline will be published soon, and probably in July, you will have a new guidelines on bowel cleansing. And eziclen is, of course, described in details, and the indications of eziclen are clearly written in this guideline. So you will see, okay. So they compare the different products, and eziclen really has a role in this guideline. So this is a conclusion. So Aciclen is highly accepted by the patients. It does induce, in fact, a successful cleansing of bowel in 97% of patients. Especially, it cleans the right colon. It has a good safety profile, and it can be used in high-risk patients, so elderly patients with hepatic disease, patients with some renal impairment, and patients with congestive heart failure. So, personally, we are using this product. I personally think that this product has a great future. Thank you very much.
Терри, большое спасибо за очень интересный обзор. Давайте мы зададим вопросы, если они возникли. Пожалуйста, кому угодно. Да, пожалуйста, Дмитрий Вячеславович. Questions.
Question? Okay. No. 1 minute.
Месье Поншон, блестящая презентация, спасибо большое. У меня вопрос, касающийся подготовки особых групп пациентов. Сейчас фокус во всех аудиториях в России и за рубежом на отдельные группы пациентов, сложные для подготовки колоноскопии. И в Европе, и в России тенденция идет к увеличению возраста пациента, к старению пациентов. И у этих пациентов чаще имеют запоры. Существуют рекомендации, которые говорят о том, что пациентам с запорами необходимо назначать до подготовки колоноскопии слабительные средства в течение 5-7 дней. Однако, используя Aciclen в своей клинической практике, я обращаю внимание, что абсолютно нет никакой разницы среди пациентов с запорами и среди пациентов без запоров. Мой вопрос состоит в том, что какие сейчас рекомендации существуют лично ваши, как эксперта и Европейского эндоскопического общества, касающиеся этой группы пациентов с запорами. Есть ли какие-то особенности их подготовки? Применительно к препарату, о котором мы сегодня говорили.
Okay, thank you for your... I can't say you are one of my students, but we were working together. Thank you very much for this question. In fact, I'm not a magician. Huh? Okay, maybe I look like a magician, but I'm not a magician. So even in my unit, it's difficult to prepare patients with constipation, especially old patients or patients with a lot of medications. Huh? And in this case, first of all, this is the only case. These are the only case we do. We use a specific diet and laxative before. Okay. First of all, specific diet and laxative before. And then, paradoxically, we ask this patient to come to stay at the hospital for the preparation. Because usually the patient prepare at home, okay? But in this case, they prepare at the hospital. They prepare at the hospital to be sure that they take the whole preparation and to follow the preparation and to encourage the patient to take the preparation. Because they are old, etc., and if they have constipation, they can suffer for nausea, vomiting. So paradoxically, we ask the patient to come to the hospital. Usually, we always say when your patient is hospitalized, the preparation is not so good because they stay in a bed, etc. But we encourage the patient to come at the hospital. They have to work in the corridor. They have to make some exercise in order to be well prepared. So these are my main advices. But now concerning the different types of preparation, we don't care. Of course, we use now the modern preparation, so MoviPrep or Aciclen. And we avoid to use PEG.
Спасибо.
So it's very basic, huh?
Есть ли еще вопросы, коллеги? Хорошо, тогда благодарим.
Yes?
Большое вам спасибо. Может быть, в дискуссии потом еще появится, мы их обсудим все вместе.